this little product can make a big impact on your finger if it is triggering. So it comes in different sizes. I have 2 sizes here with me. They say the size on the back. This one is a 4, and then this one is a 7. So they go all the way up to like 14. So I'll put a link, and then you'll want to make sure that you measure yourself so you know which size is right for you. The way that this helps with trigger finger is, so say my middle finger is popping or clicking. So this video isn't really about trigger finger or the signs and symptoms of it, but if you know you have trigger finger, or you know that your finger is catching or locking, meaning like when you make a fist, you have a hard time lifting it back up, that's an indicator that you could possibly have a trigger finger. You want to get a doctor to make that diagnosis for you. But if your finger's really clicking or popping whenever you're making a fist, or it's getting stuck, that is a good sign that you could have a trigger finger. And that's an inflammation of your flexor tendon, and your tendon goes through pulleys. So there's a bunch of pulleys on your fingers that help hold the tendon down against the bone. If you didn't have those, our tendons would be popping away from the bone. So sometimes though, that swelling gets enlarged. So the fluid around that tendon becomes bigger, and it's like pulling a grape through a straw, which is usually right down there because that's where people have the most pain. And when you go to grasp, it's like pulling that thickened area through something that's like this size meant for something that's like this size. And that's why you get that popping or that clicking or that catching, and then it can stay down, and then it's unable to get back through that pulley, and that's when you have to like physically pull that up. So say my ring finger is getting stuck down. So you put the oval 8 splint on your finger, and you put it so that the round part is fitting over your joint. And what happens is it keeps you from making a full fist. So it still lets you bend here at the tip, which is important, and it still lets you bend at the knuckle, which is also important. But it won't let you make the full fist, which is what causes the trigger finger, is when you bend at all 3 joints. Some trigger finger products or splints will go all the way down through the knuckle and actually block you from bending at the knuckle, and they let you bend here and here. I don't have one of those with me today, but those are usually fine too. But if you can keep this one or the one here from bending when you make a fist, you should be able to eliminate that catching and popping. The goal is to make sure you avoid the catching or the popping. Some people think that if they grip a ball, they can kind of grip the trigger finger right out of there, but that's not the case, and in fact that can make it worse. So you want to avoid the clicking and popping, and this ring can really help that. So it still will let you use your hand for light activities, because you still should be able to like hold an onion if you've got a cut. You should still be able to do some laundry. You should still be able to, blow dry your hair. It's not going to affect your function as much as like a really big splint would. Now, I will make note that this joint then is going to get a little stiff if you have it on all the time. Now, you can take it off at nighttime as long as you notice when you're sleeping that you're not clenching your fist and when you're sleeping, because then when you wake up you may notice, oh no, it's back to where it was. When you take the splint off, if the joint feels very stiff, what you can do is just do some gentle movements where you just are taking your other hand to gently bend that joint so it doesn't get very stiff. So notice I'm just gently moving the joint with this hand. I don't want to come all the way down and potentially have that start triggering or popping again and get more inflammation to that area. If you want to try the Oval 8 splint to help block that full motion, to help get rid of trigger finger, I think this could help you. 4 to 6 weeks is going to be about the amount of time that you'll need to get the inflammation out of that tendon and let that tendon rest before you start noticing a difference in your finger, and hopefully that trigger finger has gone away. I would slowly wean yourself out of that. Basically meaning take it off every once in a while for light activities. If you need more assistance or you're looking for more information on how to get rid of trigger finger, or perhaps what you should do after a trigger finger surgery, follow the link below. We can show you exactly what you need to do online for preventing trigger finger, for how to stop trigger finger, or what to do if you tried everything and you still had to have trigger finger release. We can help you. Thanks for watching. Like our video and subscribe to virtualhandcare.com.